Margaret was 73, healthy, active, volunteered at her church 3 times a week. Her doctor said, "Time for your routine colonoscopy."
What happened?
Perforated bowel during the procedure. Emergency surgery. 3 weeks in ICU. She survived, but she was never the same.
From a screening test?
From a routine screening test. And here's what kills me. Statistically, at 73, that test was more likely to harm her than help her.
In Japan, we stopped recommending colonoscopies after age 75. The risks outweigh the benefits.
Yet in America, I see doctors ordering them on 80-year-olds. And colonoscopy isn't even the worst one.
There are 5 medical tests that can do more harm than good after 60.
Tests your doctor might be recommending right now.
Some of them seem harmless. Blood work, imaging, cancer screenings.
But after 60, your body changes. The risks are different. The benefits, sometimes they disappear entirely.
And yet no one talks about this.
Because it's uncomfortable. Doctors don't want to say, actually, you're too old for this test.
But today, we're saying it.
Hi everyone, I'm Dr. Robert Harper, specialist in elderly care.
And I'm Dr. Akira Tanaka, family physician. Robert, I've been looking forward to this conversation.
Same here. Because what we're about to discuss, it could literally save your life. Or at least save you from unnecessary harm.
We're covering 5 tests that are routinely ordered for people over 60 that can cause complications, false positives, unnecessary treatments, even death.
And 5 tests you actually need that doctors often skip.
By the end of this, you'll know exactly what to ask for and what to refuse.
Even if your doctor pushes back.
Especially if your doctor pushes back.
Should we start with the one that scares you most?
Colonoscopy. Let's go there.
Colonoscopy after 75. This is where I lose sleep. Because I see it all the time. Patients come in, doctor says you're due for your 10-year colonoscopy.
And the patient is 78, 82, sometimes 85 years old.
Exactly. Now here's the data. After age 75, the risk of serious complications from colonoscopy jumps dramatically.
What kind of complications?
Perforation. That's a tear in the colon wall. Bleeding, especially if you're on blood thinners. Sedation complications, heart attacks during the procedure, even strokes.
In younger patients, these risks are tiny, maybe 1 in 1,000.
But after 75, it jumps to 1 in 100. And after 80, some studies show 1 in 50.
That's a 2% risk of serious harm.
Versus what benefit? Here's the thing. Colon cancer grows slowly. If you're 78 and we find a polyp, it would take 10 to 15 years to become cancer.
So statistically, something else will affect your health before that polyp ever matters.
Right. The U.S. Preventive Services Task Force says stop routine colonoscopies at 75. Yet I see doctors ordering them at 82.
Why do they keep ordering them?
Habit. Fear of missing something. Sometimes financial incentives. Gastroenterologists get paid for procedures.
But the patient pays the price.
Margaret paid with 3 weeks in ICU. And she wasn't even high risk going in.
So what should people over 75 do instead?
If you have no symptoms, no family history, no previous polyps, you can stop. You're done. Your last colonoscopy at 70 or 72 was likely your last one ever.
And if you do have symptoms, bleeding, change in bowel habits, unexplained weight loss,
then it's diagnostic, not screening. Different calculation. We're looking for a known problem.
That makes sense. What about alternatives? Stool tests like Cologuard?
Great option for people who can't or shouldn't do colonoscopy. Less accurate, but also 0 risk of perforation.
In Japan, we use stool tests as first line for older adults. Only colonoscopy if the stool test is positive.
Smarter approach. Why subject everyone to an invasive procedure when a simple stool test catches most cancers?
Because in America, colonoscopy is the gold standard. It's what everyone expects.
And that expectation is killing people, or at least harming them unnecessarily.
So if someone is 76, their doctor says, time for a colonoscopy, what should they say?
Ask 3 questions. 1. Do I have symptoms or high risk factors? 2. What's my life expectancy based on my overall health? 3. What are the complication rates for my age?
And if the doctor says, we always do this at your age?
Say, I'd like to discuss alternatives. Can we do a stool test instead? Or, I'd like a second opinion.
You have the right to refuse any test.
Absolutely. And if your doctor gets defensive, that's a red flag.
A good doctor should be able to explain why the test is necessary and discuss the risks openly.
Let's move to test number 2. This one is even more common and just as problematic.
Annual mammograms after 75?
You read my mind. Mammograms. Women have been told for decades, get your annual mammogram. It saves lives.
And for women in their 50s and 60s, that's true. The data is solid.
But after 75, the benefit drops dramatically, while the harms increase.
What are the harms? It's just an X-ray.
False positives. After 75, breast tissue changes. Mammograms pick up abnormalities that look suspicious but aren't cancer.
Leading to unnecessary biopsies.
Exactly. I had a patient, 79 years old. Mammogram showed a suspicious mass. Biopsy? Benign. But the biopsy caused an infection. Hospitalized for a week.
All from a screening test that wasn't even necessary.
And here's the kicker. Even if we find early-stage breast cancer in a 79-year-old, treatment might not extend her life.
Because breast cancer in older women grows slowly.
Very slowly. Studies show many elderly women die with breast cancer, not from it. Heart disease or stroke gets them first.
So detecting a slow-growing cancer that would never cause symptoms doesn't help.
Worse than doesn't help. It causes harm. Because once you find that cancer, now you're treating it. Surgery, radiation, hormone therapy.
All with side effects that reduce quality of life in the final years.
Exactly. The American Cancer Society says women with less than 10 years life expectancy should stop screening mammograms.
But how do you know your life expectancy?
Good question. There are calculators online based on age, health conditions, functional status. Your doctor should discuss this with you.
In Japan, we have a cultural acceptance of, at a certain age, we stop aggressive screening and focus on quality of life.
America struggles with that conversation. We have this mindset of more testing equals better care.
But sometimes, less testing is better care.
Especially when the test causes more anxiety and harm than benefit.
So women over 75 should talk to their doctor about whether mammograms still make sense for their individual situation.
Right. And if you have significant health problems, heart disease, diabetes, limited mobility, the answer is probably no.
What's test number 3?
PSA testing for prostate cancer in men over 70. This one makes me angry because we've known for years it doesn't work.
Doesn't work?
PSA, prostate-specific antigen, is a blood test. High levels might mean cancer, or might mean nothing.
High false positive rate?
Extremely high. Enlarged prostate, infection, even ejaculation can raise PSA. So we do the test. It's elevated. Now we need a biopsy.
And prostate biopsy is not risk-free.
Bleeding, infection, sepsis. I've seen men hospitalized from biopsy infections, and most of those biopsies, no cancer.
But what if they do find cancer?
Here's the problem. Most prostate cancers in men over 70 are slow-growing. They'll never cause symptoms. The man will die of something else first.
So finding it doesn't change the outcome.
Worse. Because once you find it, you feel obligated to treat it. Surgery, radiation, both cause impotence, incontinence, sometimes permanent.
Ruining quality of life to treat a cancer that would never have caused problems.
Exactly. The U.S. Preventive Services Task Force says Don't do routine PSA screening after 70. Yet doctors still order it.
Why?
Same reasons. Habit. Fear of missing something. Patient expectation. Men come in and ask for it.
Because they've been told for years PSA saves lives.
But the data doesn't support that. Multiple large studies show PSA screening in older men doesn't reduce prostate cancer deaths.
So we're causing harm, impotence, incontinence, without saving lives.
That's the tragedy. I had a patient, 76, healthy, active. PSA came back elevated. Biopsy, low-grade cancer. He chose surgery.
What happened?
Permanent incontinence. He wears pads every day now. And the cancer? It was so slow growing, it never would have affected him.
He sacrificed his quality of life for nothing.
Because the test told him he had cancer. And no one explained that doing nothing might be the best option.
Active surveillance, monitoring without treatment, is a valid choice for low-grade prostate cancer in older men.
Absolutely. But you can't do active surveillance if you never find the cancer in the first place. Don't test, don't find, don't treat.
Simple, but hard for people to accept.
Because we've been conditioned to think finding cancer early is always good. But for slow-growing cancers in elderly patients, it's often harmful.
What should men over 70 do if their doctor orders PSA?
Ask, what will we do if it's elevated? If the answer is biopsy and possible treatment, ask, will that treatment extend my life or just reduce my quality of life?
And if you have other serious health conditions, heart disease, COPD, the answer is almost always skip the PSA.
You're not going to live long enough for a slow-growing prostate cancer to matter.
That's a hard truth, but an important one.
Test number 4. This one surprises people because it seems so harmless. Annual EKGs and stress tests.
For people with no heart symptoms?
Exactly. Screening EKGs and stress tests in asymptomatic people over 60. They don't help, and they cause a cascade of unnecessary interventions.
How so?
EKG picks up an abnormality. Could be normal variation. Could be artifact. But now the doctor is worried. Orders a stress test.
Stress test shows something equivocal.
Right. Not clearly normal, not clearly abnormal. So now we need a cardiac catheterization. Invasive test. Thread a catheter through your artery into your heart.
With risks. Bleeding, blood clots, heart attack during the procedure.
And the catheterization shows, surprise, your arteries are fine. Or maybe there's some mild narrowing that doesn't need treatment.
But you've been through 3 tests, a lot of anxiety and some risk, all because of a screening EKG you didn't need.
I see this constantly. Patient comes in for a physical. Doctor does an EKG, finds a minor abnormality. 6 weeks later, the patient is getting stents they don't need.
Unnecessary stents.
Studies show up to half of elective stents in stable patients provide no benefit over medication alone.
But they do provide risk. Stent placement is invasive. Bleeding, infection, you have to be on blood thinners.
And the blood thinners cause their own problems. Falls, bleeding, especially in elderly patients.
All triggered by a screening test you didn't need.
The U.S. Preventive Services Task Force says, do not do screening EKGs in asymptomatic adults. No benefit.
But if you have symptoms, chest pain, shortness of breath, that's different.
Completely different. If you have symptoms, absolutely get tested. That's diagnostic, not screening.
What about people who want peace of mind? They feel fine, but want to make sure their heart is okay.
I understand that impulse. But the test might give you the opposite of peace of mind. It might find something that leads to more tests and more worry.
And the thing it found might not even be significant.
Right. Better to focus on the things we know prevent heart disease. Blood pressure control, cholesterol management, not smoking, exercise.
Those interventions have proven benefit. Screening EKGs in healthy people don't.
Last dangerous test. Number 5. Full-body CT scans.
Oh, this one worries me too.
Full-body CT scans are marketed directly to consumers. Come in, get scanned. We'll find anything wrong before it becomes a problem.
Sounds appealing.
But it's a disaster waiting to happen. CT scans find abnormalities constantly. Lung nodules, liver spots, kidney cysts. Most are benign.
But once you see them on the scan, you have to investigate.
Exactly. Follow-up CT in 3 months, or biopsy, or surgery to remove it just to be safe.
All with risk and cost, usually for something that was never going to cause a problem.
I had a patient, 68, paid out of pocket for a full-body CT. Scan found a small lung nodule. We biopsied it. Complication, collapsed lungs.
And the nodule?
Benign. Scar tissue from an old infection. Would never have caused symptoms.
So he paid for a test that led to a complication from investigating something that wasn't even a problem.
That's the full-body CT business model. Find things that aren't problems, create anxiety, generate more testing.
And there's radiation exposure too.
One full-body CT delivers as much radiation as hundreds of chest X-rays. If you do it annually, you're increasing your cancer risk.
Ironically, getting scanned to prevent cancer might cause cancer.
Exactly. No major medical organization recommends full-body CT scans for screening.
But companies market them directly to worried consumers.
And charge $2,000 or more for the privilege of unnecessary anxiety and risk.
What if someone has a strong family history of cancer and wants to be proactive?
Then talk to your doctor about targeted screening based on your specific risk. Family history of colon cancer. Do colonoscopy at the appropriate age. Family history of lung cancer and you smoked. Do low-dose lung CT once.
Targeted screening based on risk makes sense. Scanning your entire body hoping to find something does not.
All right, we've covered the 5 dangerous tests. Let's flip the script. What tests do people over 60 actually need that doctors often skip?
This is the conversation we should be having more often.
Test number 1 that's often skipped. Bone density scan for osteoporosis.
Women get this more than men, but men need it too.
Exactly. Every woman over 65 should have a bone density scan. Men over 70, especially if they have risk factors. Low body weight, steroid use, family history.
Why is this test so important?
Because osteoporosis is silent until you break a bone. And after 65, a hip fracture can be catastrophic.
What do you mean catastrophic?
20% of people over 65 who fracture a hip die within a year. Not from the fracture itself, but from complications. Pneumonia, blood clots, loss of independence.
So preventing that fracture in the first place is critical.
And we have good treatments. Weight-bearing exercise, calcium, vitamin D, medications if needed. But you have to know you have osteoporosis first.
The test is simple, quick, non-invasive. DEXA scan.
Takes 10 minutes. Minimal radiation. Gives you a T-score that tells you bone density compared to a healthy young adult.
If your score is low, you start treatment before you break something.
Exactly. This is a test where early detection actually matters, and treatment actually helps.
Unlike some of the screening tests we talked about earlier.
Right. Yet I see patients all the time, women in their 70s who've never had a bone density scan.
Why is it being skipped?
Doctors forget. Patients don't ask. Insurance issues sometimes. But Medicare covers it.
If you're over 65, ask your doctor. When was my last bone density scan? Do I need one?
Test number 2 that's often missed. Vision and hearing tests.
These seem obvious, but they get neglected.
Because they're not part of a standard physical. You have to go to an optometrist or audiologist separately.
But vision and hearing loss dramatically affect quality of life and safety.
Vision loss increases fall risk. You can't see obstacles. Depth perception is off. Falls lead to fractures, head injuries.
And hearing loss is linked to cognitive decline, social isolation, depression.
Studies show untreated hearing loss accelerates dementia. When you can't hear conversations, you withdraw. Your brain gets less stimulation.
Both are treatable. Glasses, cataract surgery, hearing aids.
And modern hearing aids are incredible. Much better than 10 years ago. Bluetooth connected, adjustable.
Yet many people resist them.
Vanity. Cost. Stigma. They don't want to look old.
But struggling to hear every conversation, that makes you seem older.
Exactly. And the social isolation that follows is devastating.
Everyone over 60 should get annual vision checks and a hearing test at least every 2 years.
If you notice you're turning up the TV, asking people to repeat themselves, get tested.
Don't wait until it's severe.
Test number 3. Blood pressure monitoring, but done correctly.
What do you mean correctly?
One blood pressure reading in a doctor's office isn't enough. You need multiple readings over time.
Because of white coat hypertension. People get nervous at the doctor. Blood pressure spikes artificially.
Right. Or the opposite, masked hypertension. Normal in the office, high at home.
So home blood pressure monitoring is more accurate.
Much more accurate. I recommend everyone over 60 get a home blood pressure cuff. Check it twice a day for a week.
What numbers should they be aiming for?
Under 130/80 is the current guideline. But for people over 75, there's debate. Some evidence that 140/90 is okay if you have no other risk factors.
Too low can cause dizziness, falls.
Exactly. I've seen elderly patients on too much blood pressure medication. They're falling because they're dizzy.
So it's about balance. Not too high, not too low.
Right. Work with your doctor. Bring your home readings. Adjust medications based on real-world data, not one office reading.
Test number 4. Diabetes screening. Hemoglobin A1C.
This one is critical and often missed until diabetes is advanced.
A1C tells you average blood sugar over 3 months.
Everyone over 60 should get this checked annually, more often if you're overweight or have a family history.
Because type 2 diabetes often has no symptoms early on.
By the time you have symptoms, thirst, frequent urination, you've had high blood sugar for years, and the damage is done. Nerve damage, kidney damage, vision problems.
Catching it early with A1C, you can reverse prediabetes with diet and exercise.
Absolutely. A1C between 5.7 and 6.4 is prediabetes. That's your warning. Change your lifestyle now. You can prevent full diabetes.
What lifestyle changes work best?
Weight loss, even 5 to 7% of body weight. Reduce refined carbs. Add more vegetables and protein. Exercise, especially after meals.
Walking for 15 minutes after dinner can significantly lower blood sugar.
Simple, effective, free. Yet most people don't do it because they don't know they need to. They haven't been tested.
So get your A1C checked. Know your number.
Last test that's often skipped. Number 5, cognitive screening.
This is a sensitive topic.
It is. People don't want to admit they're having memory problems. Families don't want to bring it up.
But early detection of cognitive decline matters.
It does, because some causes of memory problems are treatable. Vitamin B12 deficiency, thyroid problems, depression, medication side effects.
If we catch those early, we can reverse the cognitive symptoms.
And even if it's early Alzheimer's or dementia, knowing early allows for planning. Legal, financial, care decisions, while the person can still participate.
What does cognitive screening involve?
Simple office tests. Mini mental state exam. Montreal Cognitive Assessment. Takes 10 to 15 minutes. Tests memory, attention, language, visual spatial skills.
Not a definitive diagnosis, but a screening to see if more evaluation is needed.
Right. If the screening is abnormal, we do more detailed testing. Blood work to rule out reversible causes. Sometimes brain imaging.
When should someone get screened?
If you or your family notice memory changes, forgetting appointments, repeating questions, getting lost in familiar places, Don't brush it off as normal aging.
Some memory change is normal with aging, but significant change is not.
Exactly. Forgetting where you put your keys occasionally, normal. Forgetting what keys are for, not normal.
The earlier you catch it, the more you can do.
And there are new medications now for early Alzheimer's. Not cures, but they can slow progression.
So cognitive screening is another test that's underutilized but genuinely helpful.
All right, let's summarize everything. 5 tests to avoid or be very cautious about after a certain age.
Colonoscopy after 75, unless you have symptoms or high risk.
Annual mammograms after 75, especially if you have limited life expectancy.
PSA screening for prostate cancer in men over 70.
Screening EKGs and stress tests in people with no heart symptoms.
Full-body CT scans marketed as preventative screening.
And 5 tests that people actually need but often skip.
Bone density scan for osteoporosis.
Regular vision and hearing tests.
Proper blood pressure monitoring at home.
Hemoglobin A1C for diabetes screening.
Cognitive screening, if there are memory concerns.
The theme here is, more testing is not always better. After 60, it's about smart testing.
Testing that matches your individual health status, life expectancy, and goals.
If your doctor orders a test, ask 3 questions. Why are we doing this? What will we do with the results? What are the risks?
Those 3 questions empower you to make informed decisions.
And don't be afraid to say no. You have the right to decline any test or treatment.
A good doctor will respect that and work with you to find an approach you're comfortable with.
What I want people to take away from this conversation is, you're not just a passive recipient of healthcare.
You're a partner. You have knowledge now about what helps and what can harm.
Use that knowledge. Speak up. Ask questions. Push back if something doesn't make sense.
Your health, your body, your choice.
We'd love to hear from you. Have you been in a situation where a doctor recommended a test and you weren't sure if you needed it?
Or maybe you had one of these tests and experienced complications. Share your story in the comments.
Helps other people learn from your experience.
And if this information was helpful, share it with someone over 60 who might benefit.
This could prevent someone from going through what Margaret went through. Unnecessary harm from a test that wasn't needed.
Next time, we're talking about medications that become dangerous after 60.
Oh, that's going to be a big one. I have strong opinions about sleeping pills and muscle relaxants.
And I want to discuss blood pressure medications that cause more falls than they prevent.
Looking forward to it. Until then, take care of yourselves.
Be your own health advocate. Stay informed and stay well.